It is a story you've seen the headlines on, but let's follow it more closely. Baby formula manufacturer, by the way, ByHeart, has recalled all of its products sold nationwide, all of them.
Yeah, the move comes days after some batches were recalled amid an outbreak of infant botulism.
According to state and federal health officials, at least 15 babies in 12 states have been sickened in this outbreak since August, with more cases pending. So joining us now is ABC News medical correspondent Dr. Darien Sutton. Dr. Sutton, I'm so glad you're here for this because you hand your baby the bottle of formula that you trust, and then they have these symptoms. What is botulism?
So important to talk about this because you're absolutely right. There's a lot of assumed safety with the products that we eat, and sometimes these moments make us question everything. So infantile botulism is due to a bacteria most often called Clostridium. And what happens is that bacteria produces spores that are resistant to the normal processes that help to protect us against bacterial infections. And those spores are ingested by infants. Most often this happens to children under 6 months, but it can happen to children under a year old as well. And they create a neurotoxin that leads to muscle weakness and eventually paralysis. And if it's untreated, it can lead to death, which is why it's so important to talk about this.
I heard one of the moms describing it, that her swallowing wasn't happening. And that has to be frightening because you mixed the formula, right? Right? All right. So let's talk about the expanded recall, because I think a lot of people, oh, sorry, wait a minute, let me get the water out of that. I think a lot of people are wondering about that.
Yeah. So when this expanded recall happened, ByHeart is essentially expanding their recall to recall all baby formula by ByHeart. So checking the notification to make sure your lot number is not involved in that. But I think if you have a product by this company, just checking it in general is probably helpful. And then knowing the symptoms of botulism for infants. And as you said, one of those symptoms can be difficulty feeding, as it affects the muscles, not just the muscles we can control, but the muscles that help us to digest. That can lead to persistent constipation, even a weak cry, and at its most severe extent, it can lead to a floppy baby or a loss of head control. Most importantly here, although this is technically due to a bacterial infection, it won't come with a fever, and that child will be mentally aware. They just won't be able to control themselves.
So it'll be harder for you to really tell. You have to look at your baby carefully.
You have to look at your baby carefully, and this is the type of patient that should come to the emergency room if you are concerned about an exposure and if your child has symptoms.
Drill it in your head, don't give babies honey before they turn a year old because of this.
Yeah, and
so
that's
scary.
the most common cause.
So what should parents right now who have this formula, or any formula, I guess, I would imagine if you have any formula at home, you're a little taken aback by this. So what should parents do right now? So
reassuring that this is limited to this specific company right now, ByHeart, but I think always staying up to date on any recall is important, and especially in these times. You know, we're seeing more and more of them for a variety of reasons. So making sure that you're aware, but then knowing the symptoms and having open conversations with your provider. And if you're concerned, better safe than sorry. I would rather talk to a parent about why their child does not have this than seeing a child that is having symptoms at home without treatment.
And it's treated. This can be treated.
Extremely treatable. Babies get medications for this, and it can be reversible. The thing is that the longer that this takes effect in a child, and the more severe the symptoms, that means the longer the recovery, and that can be up to weeks.
So many food and product concerns. I want to invite you back to talk about why we're in the situation that we're in.
Absolutely.
But thank you for getting the information out that'll hopefully get parents ready to help their children.
Absolutely.
Thank you, Dr. Sutton.
Of course.
Thank you.